Hi, I'm Dr. Sarah Holdt and I'm an OBGYN in Sarasota, Florida. Today I'm going to answer some questions that a lot of expecting women have regarding the impact of coronavirus and its disease, COVID-19, on pregnancy. I'm a member of the Star Legacy family since losing my son in 2017, so I understand the anxiety this is causing on a personal level as well as a professional one. Before answering the questions, I want to start with a few words that I hope are reassuring. Statistically, COVID-19 is only very rarely causing significant illness or death in either pregnant women or infants and children. As of April 4th, there are over 1.1 million documented worldwide infections, and in the US, there are 277,000. In all of those infections, it has been really big news when an infant or child has become critically ill, because overall, they just haven't been highly impacted. So while, of course, this is still scary and no one can be told that their child will be 100% safe and not affected, the odds are still extremely low that any given child will be. The statistics so far are vastly overwhelmingly positive for infants and children. Similarly, while some otherwise healthy women of childbearing age have become very sick and some have passed away, overall, the odds that any given young woman would become seriously ill remains low. None of this means that we shouldn't take COVID seriously. We absolutely should. It is very dangerous in general. But we also need to be able to compare the actual risk of COVID to any given pregnant woman to the other typical risks of pregnancy and delivery for that woman. The first question is, if a mother is infected with COVID-19 while pregnant, what are the effects on the baby at different stages of development? And is there a trimester that is more dangerous than the others? Unfortunately, it is still too early in the disease's lifespan to know this answer for sure. We haven't been 40 weeks since the first documented cases. But so far, everything I've read indicates that there is likely very low risk, maybe no risk, of infection passing to the fetus. So theoretically, fetal development should be relatively unaffected, regardless of trimester. Pregnant women, again, have not been becoming critically ill at any higher rate than non-pregnant women of their own age and underlying health status, regardless of trimester. And really, this is all very exciting news because other respiratory illnesses historically have been more dangerous to pregnant women, but that just hasn't been seen with COVID-19 so far. Unfortunately, though, we are still so early in the existence of this virus that more information may come out as time goes on. But so far, the data has been reassuring. The next question. Many women are changing their birth plan to deliver at home or a birth center away from the hospital due to fear of being exposed to COVID-19 while in the hospital, or not wanting to have to be forced to deliver without their chosen support team beside her. How do I help women make these decisions and balance the risks and benefits? At this time, I would say that we have to remember that all of the usual risks of pregnancy and delivery don't become any less common just because we are also now worried about an additional possible complication. Home births and birthing center births are proven to be less safe than hospital births, and home births in particular have statistically significantly higher rates of infant death than in a hospital. So that, compared to the still relatively low odds of a woman of childbearing age actually becoming critically ill with COVID, or an infant becoming critically ill with COVID, I believe that both mother and baby are still very much best served by delivering in a hospital or an accredited birthing center at the very least. Labor and delivery units are typically very controlled settings, and security has just been tightened now countrywide to try to limit the possible spread of coronavirus within a given labor and delivery unit. Birthing centers, I think, could still be passing the infection as much as a hospital could because they're still a public place. And again, home births to me are just too dangerous to ever recommend them really under almost any circumstance. The next question. Would a pregnant woman have the same symptoms of COVID-19 as a non-pregnant person, or are there different symptoms she should watch for? I have not so far read any information stating that pregnancy results in a different symptom course for COVID. The majority of women in this age group will have the mild symptoms. And so I'm still just telling my patients to watch out for a fever. And then if they in particular have worsening shortness of breath beyond their normal pregnancy shortness of breath, then we would need to see them right away. The next question. If a woman has COVID-19 or is suspected of having COVID-19 at delivery, what are the factors that determine if she should have a C-section or vaginal delivery? The American College of OBGYNs currently does not advise to change a birth plan due to the presence of COVID infection. So, if a patient was otherwise going to have a vaginal birth and is able to have a vaginal birth, then they still can, regardless of a COVID infection. Next question, should a woman have direct contact with her newborn after delivery for skin-to-skin contact, breastfeeding, etc. if she has COVID-19? What about if she is suspected of having it, or if she's been exposed but has no symptoms, or has not been exposed? And why do the WHO and the CDC have different recommendations on this point? To start, in general, the CDC and the WHO will sometimes differ in their recommendations because they're addressing different populations. The WHO has to include the entire world when they're making their analyses and recommendations to fit even countries with very low resources. And the CDC is focused on the current status of a given disease just in the US. So sometimes those risk-benefit analyses are just going to turn out different. So if and when, probably when, I have to counsel a patient who is COVID positive nearing time of delivery, I would probably say that, again, she and her family need to weigh the risks and benefits, knowing that, again, most infants have not become critically ill, and there are risks involved in separating a mom from a newborn that we can't just ignore. But on the other hand, we would rather, of course, not have an infected baby if we can. So if there's another person who can care for the baby and limit the amount of maternal exposure and the viral exposure for the baby, then that's something to certainly consider. Of course, some women may not even have someone else that can help them care for the baby or someone else that's not exposed, since if a mom is positive, there's a good chance that her support people also are. So these are just all things we have to consider. There's definitely harm from separating a mom from a baby right after birth. So I think this is going to continue to evolve as we get more information as time goes on, and the impact potentially on babies of the virus, if that is found to change as time goes on. But now, other than deferring to a hospital policy, I would personally hope that a pregnant woman could still maintain some contact and still be able to bond with their baby. And in the meantime, just be practicing very, very strict hygiene, of course, wearing a mask at all times around the baby, washing hands just like crazy, hand sanitizer all the time, whenever touching the baby or any of the baby's things or being anywhere near the baby, mask on all the time. And I think all of that goes for someone who's definitively infected, a person under investigation, or if they've a known recent exposure. Finally, breastfeeding is a similar obvious situation here, and so far it has been permitted because it does not seem that the virus transfers through breast milk. So the milk itself does not seem to pose any risk for the infant. However, of course, nursing is a very close intimate contact, and so if a woman does choose to want to be nursing specifically while she's infected, then definitely wearing a mask and washing hands and all body parts that are involved very carefully would be highly recommended. You could mitigate the risk by by pumping and washing the pump parts, again, very diligently, and then having a non-infected person do the bottle feeding with the pumped milk. Or if someone wants to just really try to eliminate any risk of spread via feeding, then that could be a reason to go to formula. All of those are going to be personal decisions based again on the benefits that we know exist from nursing and breast milk, but the need to also want to try to reduce any possible risk of infecting an infant. I think that answers the questions I was given at this time. So everybody, please take care and wash your hands and stay home, but still make sure also to have your regular prenatal visits with your doctor or midwife or provider. It's so important to still keep up with your prenatal care.